So my name is Emma. I am one of the founding directors of the Women's Health Clinic. We formed the company quite a few years ago, and currently I am the managing director, and we now have 10 clinics in the UK, almost 11, and we also have one in Spain. The question about choosing the Women's Health Clinic, we are a clinic that is completely nurse-led, so all female nurses. The reason that we started was because of a personal experience of mine following childbirth, and all of the nurses in our clinic have different expertise in women's health, so ranging from sexual health, gynae, urology, midwifery and so on and so forth. And that means that we can give a full comprehensive assessment of patients, right from what's happening physically, also looking holistically at lifestyle, life events, work, relationships and so on and so forth. So currently we have 10 clinics in the UK, almost 11. So we are ranging from as far north as Manchester, all the way down to Brighton and Bristol, with a couple of clinics in London as well. And each one of the nurses is local to their area, so they know the demographic of what's happening in their area. So the Nuvi is a vaginal rejuvenation treatment, and the method that we deliver that is using a carbon dioxide laser. Carbon dioxide lasers react with the water component in tissue, so it's a very superficial treatment, and the method of action that it is that it triggers in the body, something that the body sees as a wound, and that takes a process of a few weeks and months. Very little downtime, very little discomfort, and it's a 10 to 15 minute procedure. Terms like designer vagina, vaginal facelift, which we didn't like with the ITV programme, really dumb down what's happening here. What's actually happening is there's a process of a healing process where the laser is a messenger. The laser sends a signal to the body that something has happened and it reacts to that. And the normal wound healing process we all do. We know if we cut ourselves today, it's probably going to hurt a little bit more tomorrow. And that is a natural, normal process that we all go through. The appointment you have is booked as a consultation. So all of the preceding consultation is a 20-minute consultation with a nurse, just to go through your history, what's happening with you. You will then be invited to an appointment which lasts 45 minutes for the initial one. In that time, the nurse will go through your history, gynae history, sexual health, relationship, all of those sort of things. And if at the end of that procedure you want to go away, that's fine. We will retain the consultation cost, which is £25. But if you do decide to go ahead and have the procedure, you can actually have it on the day, and that will be credited back to you. When you have the procedure, you will have a consultation, which lasts at least 30 minutes. We look at whether it's something that you want to go ahead with, whether it's suitable. There is a vaginal examination, and if at the end of it, both the nurse and yourself feel it's something that's appropriate and you want to go ahead, that's fine. So the procedure takes about 10 to 15 minutes. It involves the insertion of a small cage into the vagina just to support the tissue. The laser head goes in and it has a little angled mirror at the end of it. That laser can then be targeted individually to your particular condition. You don't feel a great deal inside the vagina at the time of the treatment because there's not many nerve endings in there. There's a strange sort of buzzy feeling, a warm feeling, and again the nurse can explain to you how that feels because all of our nurses have had the procedure. We do 3 passes internally to the vaginal tissue, again very superficial, and then we remove the cage, the laser head, and we apply the laser to the external labia, around the clitoral hood, sometimes around the urethral wee tube opening. That is a little bit more sensation, but most patients compare it no worse to say having something like a tattoo or having a waxing, that sort of level of discomfort where you don't really quite like it, but it's over and done with very quickly. We recommend that if you are worried about discomfort, that you take something along the lines of cocodamol or paracetamol, no anti-inflammatories, because the first phase of wound healing is the inflammatory phase. So things like Nurofen, diclofenac, Voltarol, we recommend that you avoid. In terms of labiaplasty, what happens to the labia is around this sort of fatty area of the pudenda, the vulval area, we do lose volume there. It's the one place in women we don't want to lose fat. And that does mean that the labia do look a bit more frilly, a little bit more dusky as the years roll by, unfortunately. The best way I could probably describe it is that when we treat the external area, what you will find is a rejuvenation. So things feel a little bit more plumped up, a little bit more rosy than they have been in recent years. It does have a reduction in labia, but that's something that we cannot guarantee. So the results are based on your body's ability to have wound healing. If we thought that a labiaplasty was indicated, then we would advise accordingly. But like I say, if you've always been an outie, you will always be an outie. We can't change that. That's your personal structure. But if a labiaplasty was indicated, then we would be able to suggest methods that could happen by. So with collagen producing activities, whether it be mechanical means, so the likes of peels, needling, dermabrasion, something that fractures the surface, this is one of the methods that will stimulate collagen production. So the laser's job is a messenger. The other method is to apply heat, so radio frequency, ultrasound, in our case laser. What that does is it triggers the body to think that there's a minor wound happening, and it triggers your wound healing experience. So you know if you cut yourself today, it will hurt more tomorrow because all of that activity has been stimulated. And for most healthy human beings, that's got about a 6-month build project. The body's aim is to complete wound healing. So this is not a finite treatment. This is not a one-off. This is something that you would look to maintain. A single treatment will give you a 6-month build project. But what we know about collagen is when it goes into the collagen production phase, which typically takes about 4 to 6 weeks in most patients, is that when we're setting the footings, like we do when we're building a house, when this collagen production happens, if we stimulate the new production of collagen, we know that we can make it go on for longer. You having 10 treatments though is no different to what the recommendation is, which is 3 treatments. So 3 treatments seems to give the maximum benefit to the majority of patients, and that's where the 3 treatment protocol comes from in 30 years of research. And what we've got the recommendation from in lots of research is that 3 treatments spaced 6 to 12 weeks apart for most ladies, fits in with periods, collagen, all of those sort of things, is that seems to give you about a year to 18 months. So it gives you a bit more longevity. And from the 3rd treatment, which is the gold standard, the recommendation is to have an annual top-up because unfortunately we are all still ageing. So 1 treatment, 12 to 18 months after the first programme of 3. The downtime after the procedure is very, very minimal. It's a lot of common sense, and you will be given this information at the time that you book. You'll also be given a leaflet in the treatment time. Sensible things are that we need to let the body heal. The vagina is a good washing machine. It knows exactly what to do. It knows how to heal. You know yourself if you've had children that it does take a little while to get back to normal. Sensible things that we recommend is that nothing goes in the vagina for a week, whether that be partner, whether that be toys, whether that be vaginal estrogen, lubricant or moisturiser, but pretty much within a week you can get back to normal. With anything that is very minor, which this procedure is, you are not coming to the procedure, to the clinic for an instant result. You don't get the result straight away because wound healing takes a process of time. What we're expecting is gradual changes in things like stress incontinence, sensation, lubrication, those sort of things, because this process takes weeks and months. Some patients will get instantaneous results. You know, I could see a patient who's got menopause, who's never had children. I can see somebody that's had 6 babies. We're all unique. We're all individual. The wound healing process takes its time. What you will find is a gradual improvement in most of the presenting complaint symptoms that we would talk about. And again, your practitioner can discuss that at length. So the question about whether this treatment is suitable for everyone, with any medical procedure, there needs to be an assessment and a review. So one of the beauties is that whenever you pick up the phone, there is always a nurse at the end of that. We're all women's health trained in different varieties. So we will be looking at your history, listening to what's going on with you and making a decision from that. We don't book patients in for a treatment, we book patients in for a consultation. And before you come for the consultation, we will get you to fill in some key pieces of documentation. So looking at your gynae health, your sexual health, babies, childbirth, periods, all of those sort of things. And when you come along to the consultation, which is 45 minutes long, we will be able to explore those issues in depth. At the end of that consultation, if you decide it's something that we jointly think will work, then definitely. Is the new V safe? Is a really good question. In this country, lasers were deregulated back in 2010, and as a laser trainer and teacher, as well as a user of lasers for many years, that's a really good question. Lasers are safe as long as the person that's using it and the person that's receiving the treatment are on the same page. So we're following pre-procedure instructions, we're following post-procedure, and also if the laser is made correctly. Unfortunately, in this country with the deregulation, that means that that's not always as clear-cut as possible. However, the Women's Health Clinic, all nurses are trained at the levels that were dictated by the Health Education England guidelines, which we were a member of the committee of. And this treatment was deemed, in an aesthetics side of things, that anybody can deliver that treatment. However, we are a Care Quality Commission, so CQC registered clinic for our other activities, and we jointly agree with them that when nurses are using their nursing skills, that's what makes this more safe and also a registrable activity. And we believe that anybody that is appearing for treatments within our clinic should be assessed by a qualified healthcare professional, specifically with women's health backgrounds of one way or another. One of the happy side effects, so there's lots of things, obviously we'll discuss specifically in the procedure, in the treatment consultation with you. But one of the side effects is that a lot of ladies find that the stimulation of the blood flow, the improvement of the collagen, particularly those menopausal, perimenopausal and postmenopausal patients, is that a lot of ladies will report that there is increased sensation, there is increased desire. Some of that comes from feeling that you've done something for yourself or having a full comprehensive vaginal and personal examination, but also improving the tissue in that area, firming that tissue up, making things feel a bit more rearranged than they used to be is a happy side effect. So a lot of ladies will report that when it comes to things like climax or stimulation, that it's easier, longer and stronger, which is not a bad side effect. Atrophy is a big blanket term. So we all have different pregnancies, we all have different childbirth experiences, we all have different periods. Atrophy is a broad term to describe some of the changes that happen during menopause. This is something that your practitioner will discuss at length in your procedure and your consultation. So atrophy can present with many different things. So dyspareunia, so difficult or uncomfortable intercourse, increase in urinary tract infections, loss of volume, loss of sensation. It works on so many different levels, and again, when your nurse does her consultation and her subsequent vaginal examination, we can discuss what your symptoms are specifically. And we don't talk about the laser being the golden chalice because there are lots of different ways to address atrophy. So the use of vaginal moisturisers, the use of lubricants, the use of HRT, the use of topical vaginal estrogen. So there's lots and lots of different ways for us to help not only get the results with the new V, but to use those other methods that may help as well.